Hello, thanks so much for joining us today for this week's webinar. I'm Kim Sterrett, I'm the Director of Parent and Family Programs, and it is our pleasure to present today how to support the sick student. So it is very timely to have this conversation, and you may be getting phone calls right now at home from your student who may be experiencing some illness, and so we just wanted to give you some of the information that you might need in order to best support your student while they are feeling totally gross. So without much further ado, I'd like to introduce you to Margaret Garner, who is the Executive Director of the Student Health Center and Pharmacy. Thanks so much for being here, Margaret.
Thank you. And everyone, welcome virtually to the Student Health Center and Pharmacy. As the Executive Director, it's a pleasure to share with you services of the Student Health Center and Pharmacy and some tips on helping your student who may be ill. Let's talk about who we are and why we're here. The vision statement for the Student Health Center and Pharmacy is to be the #1 choice of our UA students for excellence in healthcare and wellness education. In fulfilling this vision, our mission is to deliver outstanding healthcare and educate our students for healthier living. We are busy. Goes without saying, close to 47,000 plus visits annually. Here are our areas of service. The bulk of our services are in ambulatory care, and that is provided 8 a.m. to 8 p.m. throughout the academic year. So those evening hours are critically important to our students. Those services, such as women's health, allergy and immunization, psychiatry, and medical nutrition therapy are during the day hours and do require appointments, whereas our ambulatory care services can be walk-in or appointment online. Just a couple of points to make. Allergy and immunizations, we do not have an allergist on site. So what we provide, as many student health centers do, is allergy injections in a safe environment from prescriptions made by your student's allergist at home. We also provide vaccinations and vaccines for international travel. Our hours of operation are extensive, some of the largest in the SEC. So during the academic year, we're actually open 62 hours weekly, including some weekend hours. Let's now talk about insurance and billing. It's complicated. So let's try to make it simple. Health insurance. It's all about your plan, parents. Think about the beneficiary card for insurance for your student, like that student's driver's license or money in the pocket or credit card. It needs to be with them all the time, whether they're at home, here, traveling during breaks. It is a must. They can have a hard card in their wallet, or as many of them do, make a copy on their cell phones, but we need the front and the back. Benefits and your coverage requirements, again, are dependent on your specific plan. So there's no really comparing what one student has versus another. The Student Health Center has students from all over the country, every state, and over 70 countries. So we deal with hundreds of different insurance companies as well as individual plans. So again, what is covered is dependent on your specific plan. Some plans, not our majority, but some plans require a referral from the student's home primary care provider in order to be seen by any other provider here or anywhere else. That's very good to know, because without that, that specific plan won't cover the visits. Billing. Student Health Center conveniently files on your health insurance, but here is what your specific plan will dictate that we have no control over. First is what they will cover and pay for. Their language is it's in network, in their network, or what they won't cover, called out of network. And that if they pay, they may pay far less for services that are provided out of network, and sometimes they pay nothing at all. So that's good to know, and a chat with your benefits representative with your insurance plan will help know that in advance. In addition, your plan dictates what is their required copay for the type of visit the student has. Finally, they dictate whether they require an authorized pre-certification or not in order to pay for a specific medical procedure. And you or your student needs to obtain this through your primary care physician or benefits representative so that a specific medical procedure will be covered. Our Student Health Center billing department is here to help you with your questions, and you can see an email and some phone numbers for your convenience. Now, a lot of our students do need lab because, as you might expect, this is a healthy population in general, but they do get sick. And so oftentimes we need lab services or x-ray services to help the providers with diagnosis. We have a reference lab and x-ray services that is available on site, same building. The vast majority of our students' needs can be processed right on site. For other lab needs, there are 2 National Reference Labs called LabCorp and Quest who provide on-site pickup for their lab needs. So again, the student doesn't have to leave the premises. Most all of our x-rays that students need can be met within the building as well. But certainly extra films or more serious kinds of images like ultrasounds, CT scans, MRIs, or contrast studies will need to be done at local resources. The hospital outpatient x-ray is just within 2 blocks and others not far away. Referral services. What happens when your student has needs that we cannot meet? Looking last year, we made approximately 1,700 referrals to subspecialists in the community. We have a great relationship with these folks, so we find we can get them in very quickly. The most common referrals have been for additional radiology, orthopedics, sports medicine, dermatology. You can see the list. It's extensive. What we do as well as we have 2 nurses who are our referral nurses. They make the appointment for your student, send relevant information with them to maximize the visit, and then they follow up for communication back to our providers so that there is 360-degree communication and follow-up. That's critically important. I mentioned earlier our pharmacy. We provide about 35 to 40,000 prescriptions annually, and our dedicated pharmacists provide medication counseling. It's important to know that we fill prescriptions that are recommended by our providers at the Student Health Center, but we also fill prescriptions that may come from your home physicians or outside specialists from licensed providers. And our pharmacy, for their convenience, has a good number of selected over-the-counter medications. And your student never has to have cash when they come to the Student Health Center. The copay for your visits, copay for medications, as well as some of those over-the-counter products they may need are charged directly to their student account. The Student Health Center is also extremely committed to prevention, and our Health Promotion and Wellness Department includes professional health educators to provide outreach prevention education. In addition, we have 160 trained volunteer peer educators that serve our students through the organization called Project Health. We also have online programs that meet some of the federal mandates for prevention education for students in colleges and universities in the United States. These are probably very familiar to you: Alcohol EDU, Haven for healthy relationships, sexual health, and prevention, and our newest one, prescription drug use and abuse. Common concerns across the nation met with evidence-based online prevention education programs for all our incoming students. Project Health, as I mentioned, is our outreach peer education program, and we have 4 distinct programs that those 160 students are engaged in. Weekly topics, different every week, and provided to our students for over 60 contact hours every week. One of the outstanding programs recognized regionally and nationally for their effectiveness. We're very proud. I am now happy to introduce to you Mrs. Susan Mitchell, one of our outstanding nurse practitioners, who's going to give you more information about your student when ill. Susan?
Thank you, Margaret. Hello and welcome. I'd like to talk to you about more about the sick student that we see on a daily basis. Students here are seen in a timely manner, often much shorter time wait than at the local ERs. Students may also make an appointment, and that way they can be seen with shorter wait time and a much timely manner. They can do this through the portal if they wish, or they can call in and make an appointment as well. The providers here that we have are very knowledgeable, and they come from a vast background. Providers that we have experience in ER, military, internal medicine, family practice, cardiology, GYN, private practice, and even hospitalists. How can I, as a parent, help my sick child? A first aid kit would be absolutely wonderful. That first aid kit can include a thermometer, and they need to know how to use it. Tylenol, Advil, how much are they supposed to take? Band-Aids, first aid cream, and other supplies. Students need to also know that their allergies, their medicines, their past medical surgical history, and their family history. And this is extremely important, for sometimes we see this patient for the first time, and their family history can be extremely important. Encourage your student, please, to use hand sanitizer in their residence and also in their backpack. Seek medical care early so that we can help them get better and get back to school, which is what their primary purpose is. And also to complete the health and history form that is for the Student Health Center and can be found online. Treating and preventing the flu. Since December of 2017, we have seen over 1,100 cases of flu or pneumonia. To put that in perspective, UA was also closed for 2 weeks over the holidays in December, and the majority of students did not come back until after the football game when classes started, so approximately January 10th for class. Through social media, the Student Health Center and the pharmacy have been educating students to cover their cough with either their arm, their hand, cough into their clothing, and then they're asked to use hand sanitizer or wash their hands afterwards. We would prefer them not go to class sick, but to come see us so that we can get them better quicker and back to class. Being sick spreads germs to one another, and the living quarters and the classes are close, and so therefore it's easy to spread other contagious diseases, and so it's best to see us first and to get better quickly. Also, educating the students is done through the social media, Health Hut, and other sources. Flu shot clinics are on campus. They are all over the campus, in the dorms, the fraternities. The Health Hut will be at different places on the quad and other places on campus. And they can also come to the Student Health Center and pharmacy and get immunizations for flu shots there. If they're being seen in the clinic and they do not have a cold or other respiratory illness, they may get a flu shot at that time as well. Flu shots are free to the students, faculty, and to the staff. What is the difference, cold versus flu? Most students that have the flu are going to have a higher temperature, often greater than 100, but could even go up to about 102. The headache with the flu is common, and it's an unusual headache. And when they take Advil or Tylenol, it'll help it, but it just doesn't go away. Their aches and pains, they may feel like they've been hit by a Mack truck, especially because of the sudden onset. They may have a congestion or stuffy nose with the common cold or with the flu. Runny nose, sneezing is also seen with the flu. Sore throat, yes, we have seen this. And also a cough. And the cough is different because it's a very deep, dry, moist kind of cough that they have with flu. Two types of flu that we have generally been seeing, flu A, which is a more typical flu. Currently, we're also seeing where it has changed and involves some nausea and vomiting and diarrhea with it, which is not usually seen with the flu. Flu B is a constant headache that is only dulled by over-the-counter medicines. They also have fatigue, chills, achiness, low-grade fever, nasal congestion. They may or may not have a cough, and they may also have some slight nausea. Other common diagnoses that we see in the clinic, strep throat and mono are very common, sinusitis, bronchitis, pneumonia, and other respiratory infections, ear infections, pink eye, headaches, urinary infections, sexually transmitted diseases, acute injuries, and we have orthopedic supplies such as crutches, boots, and other things to help the student. Back pain, a lot of times that is from the way they're studying or that heavy backpack, and they need to be reminded to carry a lesser load. We'll see abdominal pain, the GI virus, and if they are getting dehydrated from the GI virus, we can provide IV fluids to rehydrate them. Skin disorders, rashes, we'll see scabies. A lot of times they'll have animals and we'll see scabies from there. There's also tick-borne illnesses, MRSA, acne. And when the weather is nice and they're out, we'll also see where we'll get some red bugs and some chiggers from them being out and hiking. Now I would like to introduce Maria Ford, who is our marketing manager.
Thank you, Susan. I wanted to spend the last few minutes of our webinar just discussing some of the convenient advantages your student has by using the Student Health Center and Pharmacy. First off, billing we've discussed earlier, but I just wanted to remind you that we do bill insurance first if applicable, and then anything remaining goes on your student account so they don't have to have cash with them the day of their visit to either the clinic or the pharmacy. We're also happy now to accept flexible spending cards, so that's just one more option your student has to pay for their service. We also make it really convenient for them to come and visit. We have student parking out front, and then there's also multiple bus routes that will get your student to the clinic and pharmacy if they're not able to drive themselves. Then there's the patient portal, and this is more than just for appointments. Your student can access their patient portal through MyBama, and this is where we can send them test results, comments, or messages. The portal will also notify the student if there's a message by emailing them through their MyBama email account. Students can also use the portal to contact a provider that they may have seen and to schedule appointments. It's important for them to note that for gynecology, psychiatry, nutrition, and allergy, they aren't able to schedule those appointments through the portal. They can just call up to the Student Health Center and we can help them schedule it that way. They can also, if they don't have a parking pass to park on campus, they're able to download and print a parking pass from the patient portal that allow them to park out front without being ticketed while they're here for their visit. The university also provides a insurance plan for students at a very reasonable cost. So if for any reason your student needs their own insurance plan, this is available to them, and you can find information about this and how to sign up on our website, either clicking this link or just visiting our website on your own. And one last bit about kind of how to make your student's appointment or student's visit a little bit easier. We do take walk-ins and appointments during the day, but it's important for them to note that for weekend and clinic hours, those are walk-in only. And we do see a really big rush of students around the middle of the day, starting around 11. So if you know your student needs to come see us, and try to encourage them to get here earlier in the day. That'll make their visit quicker and a little bit less stressful. And finally, a last bit of additional information. We provide a lot of forms that are commonly asked for by parents and students online on our website. Some of these include a medical history form. This is very important if your student is going to be seen at the Student Health Center. So we would encourage you to have them go ahead and fill this out. You can also find an authorization to disclose medical records, a medical withdrawal policy and forms, and finally, for those of you who have been interested, advanced directive form and policy can be found on our website. And you can access all of these by clicking the link below to the forms page on our website. Awesome. Thank you. Thank you, guys.
Thank you so much. We appreciate this great information so much. Should any of you who have viewed this webinar have any questions, please feel free to contact the Student Health Center for additional information. You also are welcome to contact our office, and we will gladly get you the information that you might need. You can either call us, you can email us, or you can even just comment on this webinar through social media, and we will gladly refer the questions to the appropriate individuals and get you the answers that you need. Thank you so much. And next week's webinar will focus on supporting the academically struggling student. And so we will be nearing when students have to make their finals decisions on if they need to drop a class or not. And so we want to make sure that you have lots of information that you might need in order to best support your student who may be struggling academically. Thanks so much. Have a great day and roll Tide.